Here we are. All right. Hello, everybody. We are just getting connected, waiting for people to show up.
We look really close.
I think they said they wanted an extreme close-up. I think that's what I heard last time. That was our feedback.
Yep. I'm sure you're right.
I think one way or the other it doesn't give us a comment.
Oh, we may have to turn it the other direction.
Yeah, I think we can see more comments that way. Alrighty, we're just waiting for people to show up. Hello, hi Annette. Hi Debbie, hi Madeline.
I even pulled up
Welcome. Hopefully you guys are
numbers.
skipping out on something fun, like work, or
We are.
or home chores or something. Hello, Robert Turcolino, who I know is now Marshall Sumner. Alrighty, we're just gonna give it another minutes. Hi, Dwayne. Poor guy.
Well, now that you have nothing better to do, you can watch us, right?
Yay! Alrighty. Yeah, we might be the best thing for people who are quarantined, isolated. You got not a whole lot else going on, so you might as well watch us.
Yeah. We might start doing this 3 times a week for your viewing pleasure.
Just
We're
for
not
those
really
at
going
home.
to do that.
No. Alrighty, I think we'll go ahead and get started. Does that sound okay?
Sure.
All right, cool. Well, hi everybody, I'm Jen Bacani McKinney and I'm the Wilson County Health Officer.
And I'm Destiny Wheeler. I'm the Health Department Administrator. And we'll start off with numbers because I remember to pull them up this time.
Yay, we're so prepared today. We want you guys to know this.
Yeah, we've been sitting here for like almost 5 minutes waiting for time to start.
And
so
by that she meant 5 hours, maybe 5 days, just being ready.
Okay, so total U.S. numbers, total positive cases as of, I think today, yes. Is 3,858,686 with 141,246 deaths. And for Kansas, I had to find the right thing. As of Monday, because we get them Monday, Wednesday, Friday now, the numbers, we have 23,334 cases with 307 deaths. Wilson County has 6 cases. The state has us reported as 7, but that's because one of them is not actually ours. And hopefully they're going to get that fixed soon. So, but I think 2 of ours have recovered.
I think you're
at
right.
this point.
I believe you're correct, Destiny.
I generally
Most women are. I think that's one thing that we've learned, yes.
Yeah.
Just kidding, men, but not really kidding, women. So, last time we talked about a little bit about, as a sidebar of herd immunity, we talked about what does that mean for the population of Kansas, these numbers. And I looked up the population of Kansas because I had no idea. It's like 2 point some number that I forgot already, 2 point something million. And then so if you divide our number of cases by the 2 point something million, we are right around 0.8% of the population in Kansas who has tested positive. Again, we know that there are probably other people out there that haven't been tested, maybe have had it or whatever, but that's important in the grand scheme of things, because if we're talking about things like herd immunity, and I know there's articles out there where Sweden is saying we really tried for herd immunity and it didn't work out so well. So when we're talking about herd immunity, that may take up to 70 to 80% of the population. People are saying about 70%. Then if we're at 0.8%, then that's a long ways to go. That's a lot of people getting sick, and that's a lot more deaths. And so that's why we really are saying that we need to be careful and take care of each other, because herd immunity at this point is not in our near future, and most likely not without a vaccine.
Yep.
All right.
No comments yet. One number that I like to talk about when we talk about number of cases and things, everyone says the more people you test, the more positives you'll find, and that is true. So one number that we like to look at is percent positive. That's, I know I've mentioned it before, but it's the total number of positive tests out of the total number of tests. So Kansas was hanging right around like 8.1, and then we went up to 8.2. We're actually up at 8.9% right now. So not huge jumps, but definitely an upward trend in that percent positive statistic, and I think that that's something that we really need to keep an eye on, because we know that we're getting more tests than what we're just testing. That doesn't make any sense.
Yeah,
we know it's not just attributed to testing more.
Yeah.
Why we're getting more cases.
Yes, and so that's I think that's super important, because that tells us that our cases are still going up, and we do have better capabilities of testing. And again, here in Wilson County, our antigen testing that we're doing now, they just came out with information that it is up to 96% sensitive, which is wonderful for the antigen testing, which usually we get the results within about 15 to 20 minutes. So we're able to do that at both hospitals in Wilson County, which really is kind of cool, because we look at other counties in the state who are still sending them off to reference labs and not getting results back for days. And so again, I'm very proud of our county and what we've been able to do here, being very forward thinking. And I hope that the same goes for other counties in the near future, because the quicker we can get tests, the better. One thing that we want to stress is, because this has kind of been happening, is if for some reason your test results are not back, you should be in quarantine or isolating until your test results come back, right?
Yes.
So we've heard kind of horror stories of people getting tested, then going out to dinner or something, and then they end up coming back positive. So then all of a sudden you have exposed all these people who were at dinner. You know, especially if it takes like only an hour or two, or especially if you're having to wait a day or two, please, there's a reason you got tested in the first place. So stay home, don't be out and about.
Yes.
Alrighty. Vicki, you mentioned being worried about people wearing masks. It's a legitimate worry. We know that the research shows that we don't have treatment for this. We can treat people for their symptoms, for low blood pressures due to sepsis, for example. We can give people oxygen to help them breathe, and even put tubes down their throat to help them breathe. We can help people, when they have inflammatory responses. We've got all kinds of medications and things like that. We've come a long way just in a few months of how we treat people and how we know how to treat them. So when people comment about the death rates don't seem to be going up as high, that's because we're learning more, and we're learning by every single patient that we treat. So having said that, we still don't have a cure. We don't have a real treatment for it, and we have no other preventative measures that have been proven to work except for physically distancing and wearing masks. And so that is why we push this a lot, and it's nothing but science. It's nothing but gathering data from countries who are a little bit ahead of us in the game of, they have had to deal with this more months than we have. So it's information that we've gathered that have told us that wearing masks are the safest things for people. And really at this point we're saying, assume you have it. We're around people all day long. We've been at work this whole time. Assume you have it. We have our plexiglass between the two of us, And so do you feel okay with exposing another person, a loved one, a coworker? Are you okay with getting them sick? And if not, then wear a mask. It's very simple.
Yep. Yeah, and I know that whenever we get a new case, the question is, well, where did they get it? And statewide, the majority of the time, the answer is we don't know. We don't know. No one knows where they got it from. No one knows who they were in contact with. We ask if you were in contact with anyone with similar symptoms, and most of the time the answer is nope. And so we do know that there's asymptomatic spread of the disease, and we also know that the 2 days right before you develop symptoms are when you are you're most contagious. So if you don't want to wear a mask because you feel fine,
it's too late.
It's too late by the time if you're already shedding the virus and you're already getting other people sick, potentially.
Yep. So, there's been those arguments of, well, wear a mask if you're sick. Well, like Destiny says.
Please do. Yeah, that's
please
a
do.
good idea.
But also stay home, really, truly. Just don't
Yeah.
go out if you are sick. So,
Yeah.
And Carrie, you asked about testing. We did answer that earlier on in the video if you want to check that out again. But yes, we can still get tests back within a couple of hours here in Fredonia. So,
Have you actually treated a positive COVID case?
we have not, because our COVID cases have not been hospitalized. The one that was early on was hospitalized already before, and not necessarily like for the COVID itself. So, so no. It's a great question. Are we swabbing people? Yes, I have swabbed people. I've gowned up. My partners have gowned up, and we're doing that every day as people come in, and we've done a lot of swabbing, really.
You haven't. Have you had a positive swab come back?
Not anyone that I've personally swabbed.
Go to her. She's lucky.
Yes, I'm a lucky one. Just kidding. I think that's how that works.
I think so too.
Come on, roll the dice with me.
No.
Yes. Let's talk a little bit about transmission too. There is, as school comes up, and I think this was something that we figured that we'd have some comments. Oh, there's Dr. Norman. Hello. So we know that the state is working really hard to try to figure out how to keep our kids safe, because we know that for kids, school is a huge part of their development. Their social interactions, their cognitive development. I mean, really, like, this is a huge part of it. We want kids to be able to go back to school. Kids can get meals there when they might not have meals at home. Kids might find school to be a safe place when they might not have a safe place at home. So we know it's super important, but at the same time, we want people to be safe when they go there. Our teachers, our students, the parents that the kids go home to. So when we talk about transmission, one thing that I think is important is we're watching these studies that are happening around the world. One study that was, I think, from July 17th from Korea showed that, and it was a big study, a very large study, that showed that kids that were under 9 years old showed very little transmission amongst themselves, which is really important, because then they showed that kids 10 and over, and not that there's a magical split, but the idea is the older they get. But at 10 years old and above, kids were transmitting or infecting other people just like adults would, so in those same rates. And so I think that's really important, because we're not actually seeing a whole lot of kid-to-kid transmission. Most of the infections in kids are coming from adults that are maybe not wearing masks, not social distancing, or just by chance got the virus. I don't know. But the adults are infecting the kids. It's not so much the kids with each other. And so so that's a positive thing as we go into talking about reopening the schools, that hopefully we're going to be able to do that where the kids interact safely and there's not a lot of transmission amongst them. Do you want to do some questions before we move on to some more school stuff?
Sure, I think we hit everyone except for this last one from Vicky, and she wants to know if a person who tests positive and then completes their isolation period and is recovered can test positive again. And yes, absolutely. In fact, we're seeing that oftentimes people will continue to test positive for quite some time. It's not because they're necessarily contagious, which they're not, because they've recovered, but what the tests pick up are pieces of the viral particles and pieces of viral RNA. So when the test picks up any part of that virus, it says it's positive, whether it's a viable virus, whether it's a live virus, an infectious virus, or not. So the same thing can happen if you get a tetanus shot and then you get tested. If you get a Tdap and you get tested for whooping cough, you'll show it positive for whooping cough, even though you never actually had it, but you have some of that virus in your body. So we are seeing people who have recovered continue to test positive. Those numbers are not counted in our county totals. In fact, we have one of our recovered cases can't go back to work until she has 2 negative tests. Well, she's not been able to come back to work because she continues to test positive even though she's recovered, but she hasn't counted for any more than one of our cases. So So the difference, the different scenario is if someone recovers and is completely fine and then becomes symptomatic again, like 30 days later or more, then if they test positive again and are symptomatic, then they would be another new case. But I wanted to be really clear that even though some people have to have follow-up tests and they're positive, they're not getting counted over and over.
And we confirmed that with the epidemiologists from the state.
We got that straight from the state.
Yeah, they were super forthcoming. I mean, the great thing is that's what we found with the state is you ask the question and they give you the answer. It's a very simple concept, really, so it works out very well. There was a question about building on the kids transmission thing. What does it look like from kids to adults in transmitting? We really don't see as much of that in the younger kids, again 9 and below. And they in that study, again, nothing magical about the 9-year-olds versus the 10-year-old. Although I do have a 9-year-old, so that's kind of exciting that she's like, but don't turn 10 because that could be bad. But we see that the younger ones are not transmitting it to adults as much. Adults are transmitting to kids. Kids are not transmitting to adults or other kids as much, 9 and younger. So hopefully that works over there, Rachel.
There was what's the percentage of a person getting it twice? I don't have that.
I don't know that we have that information because I think early on we also were doing just like what Destiny was talking about. We were talking about, or we were doing these tests, and they would come back positive again, and they would say, "Oh, this patient got reinfected." Yeah, and so we in other countries that was kind of the thing. So I don't know that we have those numbers. There's still a lot of tests going on about whether people develop antibodies. Does everybody develop antibodies? And if they do, are they lifelong, or how long are they going to last? So there's a lot of questions out there still. Todd, I know you mentioned something about antibody therapy. I'm not sure. Maybe you can elaborate on that one. I'm not. Do you know?
I don't
what
know.
We're talking about there.
I haven't.
So vaccination, of course, is what our ultimate goal for beating this would be, getting vaccines that can do what it's supposed to do, protect us from the virus without a lot of side effects. So that's what we're working on. In many countries, there are so many studies, hundreds of studies going on right now.
What if antibody therapy is like using the plasma?
Oh, the plasma. Is that, Todd? Explain a little bit more if you mean like that plasma that we're talking about. So, and hi, Tom. Hello. Convalescent plasma. Okay. At this point, there's not really a comparison because we don't have a vaccine. Oh, I was watching from wherever you're watching from. I don't know where. Okay. That versus a vaccine, I don't know if that's a good. I don't know if I have an answer for you on that one because
I know
we don't have.
They had done some testing around it early on, but and it was looking promising, but I haven't heard any more since then. I've not.
But we'll keep watching. So yeah. Thank you.
Yep.
Let's see. Oh, hi, Mr. Porter. Thanks for joining us. We were just about to talk about executive orders and the school board. How fun. So actually, I did want to bring up the governor had passed 2 executive orders yesterday officially. And there's Executive Order 2058 and 2059. And so the importance of those is that 2058 is the executive order to have no school start until after Labor Day. To say, truly, you can't do anything that involves teaching. You can do enrollment and things like that, but you can't do any teaching until after Labor Day. Executive Order 2059 is the one that says that that students, faculty, and staff need to wear masks. And they're saying in kids that are 6 years old and above, and then there are exceptions, and I'm kind of reading it off the computer, like right to the side. We're very technologically advanced.
We are.
Also, we have plexiglass. Did I point that out already? It's very wobbly, but we're so safe. Okay, so exceptions would be while kids are eating, while working in a room or office that is not open to students or visitors, in which all individuals can maintain a 6-foot distance. So, like in every situation, if Destiny's here in her own office, She doesn't necessarily need to wear a mask if people are not in and out of here. You don't have customers in and out of here. While another exception to those masks are while engaged in an activity during which it's unsafe or impossible to wear a mask. If you're in PE and you're doing swimming class or something like that, there's a lot of different situations. Children who are not students and are 5 years of age or under. So, if you're not in school. Yeah.
Like a younger brother or sister or something like that.
Yep. Persons with medical conditions, mental health conditions, or disability that prevents wearing a face covering. So that would be something that could obstruct breathing, or definitely nobody who is unconscious or incapacitated should ever have a mask on for any reason. Persons who are deaf or hard of hearing, where they need to communicate with their, being able to see their mouths, that would be a reason not to wear a mask. And then if it would create a risk of the person related to their work, and so again, just a safety risk. And then persons engaged in any lawful activity where you shouldn't wear a mask. Like an example was brought up, like conceal and carry. Although, like, our kids shouldn't.
Like, we hope that doesn't apply in school.
Yes, but I think kids have sometimes guns in their trucks. I mean, it's a thing. This is Fredonia.
I don't think they're supposed to.
But so.
Yeah, I don't think they're supposed to in any way. I don't know. I would really be curious to have other examples of that.
Yeah,
that would be a little more applicable to school.
I know. So if you think of some examples, so don't wear a mask if you shouldn't be wearing a mask because it looks like you're doing something illegal. Yeah. So these are really important because what this means now, and I said hi to Mr. Porter there because he's our representative for the Kansas Board of Education. The Board of Education has to approve the executive orders by the governor, and they will be meeting tomorrow and will decide whether they approve one or both or neither of the executive orders. This came into effect at the end of the legislative session last year when they passed House Bill 2016. There's a lot of numbers today, but to say that it basically is a checks and balances thing, so that when the governor makes an executive order, it's not just like she's making all the decisions by herself. She has to kind of get the okay from other entities, and in this case, it's the Board of Education. So there you go. Ask any questions you have if that wasn't exactly clear. But we're waiting to see what the Board of Education decides. Mm-hmm. So, all right. I saw a lot of stuff, but were any of them questions?
Nope. They're all kind of comments. Do you guys have any questions? I know we're at this.
Doug says, children seem to be less affected. However, they still rely on all of us adults acting like adults and wearing masks to help prevent infection so we can continue to move forward with minimal risk. Absolutely. Okay. Mr. Porter actually clarified. We only have jurisdiction on the first order. We will not address the second one. Very good to know. So
only the after Labor Day.
Yeah, 2058. Okay. Alrighty. And Mr. Porter, I don't know if you have a chance to clarify. We're just having a good old conversation here. This is nice. So does that mean that the executive order is automatically in play then, 2059? If you have a chance, give us a little shout there. So, all right. Please keep asking questions. We're throwing a lot of information at you. You guys are so kind to come and listen. We know we're just trying to share all of the knowledge with you that we have. We're constantly reading up. We wanted to make sure to read up about things like transmission in kids because I think that's a hot topic. We still continue to read up about masks or any different types of treatments. We don't really see any new treatments that are out there that are promising, but they're still trying, every day.
Studies all the time. And one of the things, sorry, lost my train of thought. Squirrel.
That's all right.
What was I going to say?
I don't know. I bet it was going to be super good.
Oh yeah. One immunization. One immunization trial or vaccine trial is going to like the second stage. So, the likelihood of getting a vaccine is just that much higher. So, So Mr. Porter has some clarification on the executive orders. I'm going to do this almost squint.
I think it has to be addressed.
Yeah, he thinks it has to be addressed by some legislative leadership committee, but he's not sure. They're kind of acting like it's past them.
So the Legislative Leadership Committee is made up of the chairs of the different committees within the legislation. And again, it's another check and balancing. They've been in play since, forever, since the beginning of this pandemic, but even prior to that. So to say, like, if we don't think that this executive order is appropriate, then this is the group that will say that and try to overturn things. And actually, I believe they did early on one of the executive orders, but just one of them so far.
Stephanie, that's a really good question.
I do want to say congratulations to Laura, who is also watching and just gave birth yesterday. This is how cool we are. We have people who just shoved a human out of them, and now they're watching. Thank you. And then Ron, who wants his wife to visit him. We won't say why, but we'll try our best.
Yes. If I could make it happen, I would. Okay, so Steph, I will have the option to teach with a face shield or a face covering. Which one do you feel would be best for teachers to wear? So, from a disease spread point of view, face covering is better because it is actually like.
She looks like from Jurassic Park. Those little things. I do.
When you wear a mask, this is my mask I wear. It comes under your chin. It comes tight around here, and it's tight around your nose. It's how it should fit. When you wear a face shield, it's like looking through a
but you got all this
but you have all this under here. Now I look like I have like turkey neck. But you have plenty of space for droplets to get in and out underneath and on the sides. So my choice would be mask. Again, part of the executive order excludes teachers who work with hearing impaired kids and kids that have trouble with communication. So they need to see your face and they need to see your mouth and things like that. So that's why that exception is in there, because it wouldn't be nearly as effective to try and teach with a mask on for those kind of kids. So
yeah, absolutely. And now I will say, like, when we swab people, when we put our full PPE on, we wear the face covering, we wear the face shield. We also have like the full get up here. We look like giant marshmallows. But that is because we want to cover ourselves in every way possible, because we are just walking right up to, and this close to, so that we can swab somebody, we walk up to the most likely person in our near future that would have COVID. And so in addition to a mask, sure, but not by itself.
Yeah, and that's a really great point. That's the reason that surgeons wear masks in surgery and not face shields.
Mm-hmm. And Dr. Newkirk, thank you so much for, again, pointing out that Mr. Porter was super nice to even chime in. I know you don't have to, because I know you've been bombarded, Mr. Porter, so thank you so much. That really meant a lot to us.
Oh, super Stephanie cool. Just called us experts.
Oh, yes! Okay. That's our expert dance.
Who would have thought that could happen?
Oh, good. Let's see. So, Carrie, that has to do with especially if you're doing something that, if you have to show like your mouth and you're trying to teach some sort of speech, then that would be a different situation also. Do you expect our numbers to go up?
Yep.
Easy answer.
I mean, that's the short answer. Yes. Yeah. Numbers are going up all around us. Like Jen said several times, there's no wall around Wilson County. People are coming in, coming out. We're testing people from all the counties around us. I think that there will definitely be more cases before this is, a lot more cases before this is over is my estimation, but that's just a gut feeling.
Yes. Destiny said last time that, I think it was, or in a post, or maybe it was last time, but basically, when somebody does get COVID, it's not that they necessarily did something wrong. Maybe they did, maybe they didn't, but it's not our business to know, right? So assume the best with everybody. And as we see a lot of people on here that are commenting about wanting to wear masks, wanting people to take care of each other, protect each other. As we go back to school, teachers especially, are scared. There are teachers who are in that high risk zone of not being able or being at higher risk for complications of COVID. And so as we move forward, I really want us to make sure that we are kind to each other. we talk about this a lot, but people are scared right now. And I say this because Vicky's asking about numbers going up and saying that she's self-quarantining because other people are not helping to protect her. I take that very seriously. Destiny does as well. And we just want to be kind to each other. Destiny and I, when Destiny calls you up and she says, hey, you're a contact of somebody, she's not being a jerk. She's saying you could have this virus and we don't want the virus to spread anymore. And when I say something like, hey, your employee needs to not be at work right now because they're a direct contact, I'm not trying to be a jerk. It's the virus that's a jerk. I might point that out on my shirt. The viruses are jerks. None of us want to be in this situation, and all of us would love to get back to normal, whatever normal is. But we're going to be in this for the long haul, and we want to make sure that everybody's taking care of each other. Because what use is it if we're saying mean things about people or to people, because it's not helping anybody get through this. There's not a single person that is benefiting from this virus right now. Not a single person. I don't care if we think about testing or vaccine people or whatever. Everybody's working their butts off and stressed out about it. So, anyways, just a plug to say, be kind to each other, no matter if it's somebody you love or didn't love in the first place. It's just really, really hard right now for people.
Yep.
Alrighty, that's your
feel good, happy thing.
Thank you.
Please be nice.
Please be nice. Kudos to teachers who are going to have so much more responsibilities. It's true. I mean, our teachers, man, we kind of signed up for this, right? Like, as healthcare providers. Destiny, I think, had no idea what she was signing up for, so she's just like, what the hell? But we kind of knew what we were signing up for. Nurses, you know, we know that we are in dangerous situations. You know, EMS workers. I mean, people that do this kind of thing. Our teachers never signed up for this, you know, and I really want to commend them for working so hard to get those plans ready for school to start, if it possibly is going to start, and in those plans keeping our kids safe, you know, and they become then our frontline people that are taking care of people. So, all right, let's see. So, so Doug, a great comment on just, you know, it's our responsibility to take care of each other, and I think that's really important in these cases. So. Yeah. All right. Any other questions?
Any other questions? Yeah.
Do you want to see the plexiglass again? Because it's so cool. Destiny's cousin did it, right?
Yes.
Look at that. We're so safe.
You can't even hardly see it.
I know. That's how fancy we are these days. Let's see. Oh, thank you.
Thank you.
All right, you guys. If you do have any other questions, there's in the next couple of days, there's going to be a lot going on with schools and with our Board of Education, the State Board of Education. We still have a lot of things going on in the world. There are things like the fair this weekend in Wilson County. Destiny and I are not going to try to shut down the fair. We're not going to say don't go to the fair, but when we will say that when you do go, we ask that you wear a mask. We get that it's outside, but the likelihood of being able to stay 6 feet away from everybody the entire time is very unlikely, right? So just be careful. Go, but be careful, and bring your own hand sanitizer maybe, and just take care of each other.
I do know they have changed the ice cream social, and they're giving out packaged things while wearing masks. They have hand washing stations they're setting up. Like they're trying to do their part. If the rest of us all do our part, then I think that it can be much safer.
Lydia, thanks for joining us. Lydia is from KU Endowment. She also wants your money, just in case. No, just kidding. Just kidding, Lydia. She asked, how are you all caring for your emotional and mental health during this bonkers, stressful time? Do you mean us personally? Because we're good friends with wine. No, I'm just kidding, mostly. But if you mean for us taking care of other people and what we're doing in the county, I know personally as a family physician here, I've had a lot more patients call and share their anxiety and stress and just call and cry or come in and cry. So we are taking it very seriously. We're referring people to, for example, KU and Fort County, who have great therapists. We're medicating people if it's appropriate. I know that it sounds weird to talk about it, but it's not weird. This is really, and yeah, Southeast Mental Health. So we want to.
It's Fort County here.
Well, yeah, and I think like up in, is it Chanute maybe that has another? They're a different.
Yeah,
region.
they're different ones.
So, but we definitely have.
Us personally.
We're definitely treating a lot of people. So,
Yeah.
but Lydia, okay, us personally,
I've given up.
just kidding. We do these Facebook lives. It's good for our mental health.
Oh yeah.
You know, I will say that every single one of you guys who have reached out to us in any way, Facebook, even on here commenting or text or, you know, at the grocery store with your mask on, whatever it is, when you reach out to us, it means a lot to us.
A lot. In
Like, a
fact,
lot.
like I bought thank you cards. I bought thank you cards the other day. I've never used thank you cards ever, but I have gotten so many thank you cards, and every one of them meant so much to me. I thought, I've got to get thank you cards and start doing that, because it really helps to know that all that we're saying isn't just falling on deaf ears, and all the
Yeah.
stuff that we're doing is appreciated. So
I eat everything that people send me. I just want you to know that.
cheese,
Yeah, that are
lots
treats,
of
yes.
cheese.
Chocolate, cheese, and yeah, all my cards that I've received, they are on my wall in my clinic. So it's getting a little cluttered, but it's nice to just look up when you're having a little bit of a rough day, and you see nice words. So thank you guys, thank you, and thanks, Mr. Porter, for your kind words. We'll be your rock stars.
There was a question, actually. The most common question that we get is about being tested. If you were exposed to someone, when you can go to work, etc., can we expand on the current recommendations for testing and quarantine? Yes, we can.
Oh, yes, we can. Thanks, Doc. That's Dr. Nunemaker.
Yep. So if Jennifer tested positive, and we got a call at the health department, said Jennifer has COVID, we would call her and we would find out her if she was symptomatic, we would find out her contacts for the 3 days before his symptoms started, because that is when she's the most contagious. It's supposed to be 2. We go back an extra one
Just in case.
Yep.
We're
To be
thorough.
safe. Yeah. We go back those 3 days. Jennifer tells me everyone that she's been in contact with, both like
Direct,
direct,
any,
yeah,
any
so
interaction.
like technically we wouldn't be contacts because there's a barrier between us, but within 6 feet for 10 minutes is the rule, and so we would call all those people, and then we would just tell them 14 days they're in quarantine from their last contact with Jennifer. So the 14 days is their 14 days. If they develop symptoms, obviously we call them every few days. We want them to get tested. We get them tested. They turn out positive. Then they have to meet the criteria for recovery. Yeah, all I could think of was convalescent. The recovery criteria, and then once they meet that criteria, they are out. Some employers require negative tests for people to come back to work. It is not a recommendation by the health department that they do that, because we do know, as we talked about earlier, that people do continue to test positive long after they're symptomatic, or long after their symptoms are over and they're recovered, just because of those viral RNA pieces that are still in their body floating around. So so that just keeps people out of work longer. The not worst case scenario, but worst case scenario for quarantine length would be if Jennifer and I lived together and she got sick and stayed sick for weeks, and I didn't get sick because I have to quarantine for 14 days after she recovers to make sure that I don't come down with symptoms. So That could be
So
weeks
Destiny
and weeks and weeks.
she could move out of our cute little cottage that I'm imagining in our head. It's adorable, really.
Yeah.
She could move out and then start her quarantine because that would be last contact. But if she decides to stay and live with me as I'm sick and recovering, but I'm still sick, she can't count her day 1 of 14 days until I'm
she's
recovered.
clinical recovery. Yeah.
So it could be a long time.
It could be a long time. Luckily, we haven't had that here yet. But so fingers crossed, everybody.
All right. And again, I appreciate all of my doctor friends. I saw Dr. Stevens on here who has no idea what's happening in the world and doesn't realize there's a pandemic. I see Dr. Trong, our trusty oncologist, Dr. Hamlin. She pulls humans out of people all day long. Thank you very much. So thank you guys. And I apologize if I missed anyone. And of course, Dr. Norman with the state. Charles, you or Chuck, I think you said, hey girls, if I understand correctly, surgical masks should be changed every 20 to 30 minutes during continual wear. Is this correct? So the answer is no on that. We know that we actually wear these masks all day long. And if this were 6 months ago, we would have changed our mask every time we interacted with someone new. But imagine, for an example, a surgeon in a surgery for an hour, 2 hours, 3 hours, 4 hours, sometimes 8 hours. They wear that same mask that entire time. So, but now these days we know that it is safe to wear that mask as long as you're not contaminating it with other stuff or it doesn't have like other people's droplets on it. You can wear that all day long, and if you keep it safely, like in a brown paper bag or in an isolated place, then you can actually wear it other days after that until it's soiled. And that's because we know it's safe and it helps preserve protective gear. Also, hopefully that works. All right. Okay, we squeezed a couple more questions out of you guys. Man,
Yes.
Look at us. Okay. Any other questions? Last call. And thank you guys. We always go back and read all the comments, and so we appreciate the funny comments. We appreciate the nice comments.
We don't like the mean ones.
We don't like the mean ones. We love all the ones where you tell us we're so beautiful and funny, and we're like, no, stop, but don't stop.
Other People's Droplets sounds like an awesome band name.
Oh, that's actually really good.
We've got to start a band now. Mm-hmm. It's called Other People's Droplets.
Can it be me playing the air guitar?
Sure.
All right, you guys. So we'll plan on being back in 2 weeks. Tuesday, we're just going to stick with 4 o'clock.
Yeah.
If that works for everybody.
It sounds good.
All right.
All right.
Thank you. Be
Thanks,
safe.
bye.
Bye-bye.